Good afternoon to all of you for joining us for today's webinar on strategies to manage and innovate the exponential data triggered by COVID-19. My name is Rita Chan, your host for today's session. Our presenter is Dr. Sunil Mysore Kempigoda, Principal Enterprise Architect at Club Tech Info. He's a digital transformation professional who has implemented enterprise architecture practice in Australia, APAC, both for the commercial and government space. Before I pass it over to Dr. Sunil, I want to take a moment to remind you that if you have any question during the presentation, please use the question tab and we will address it during the Q&A session at the conclusion of the presentation. And today's session is also recorded and it will be sent to all of you one day after today's session. So with that, Dr. Sunil, they are all yours.
Thanks a lot, P. Welcome all. It's great to share my experiences. First of all, I want to thanks Erwin for giving me this opportunity to present. So let us just break the ice before we start. Has anyone done para jumping here? Just want to say, so anyhow, it's a remote session. So if you're not done para jumping, if you do a para jumping before, what you're going to do? First of all, you're going to consider, can I trust the instructor, what he's telling? Only if you get the confidence, you're going to trust. So I said that you must trust me for the next 40 minutes, what I'm telling you. Okay? Why? I'll tell you the reason why you must trust me. So what I'm going to do is, based on my experiences, what I've learned in the last 20 years, I'm summarizing and giving you the next 40 minutes in perspective of how to manage the data and what is the efficient way to manage the data. So said that, so first of all, as an instructor, as a presenter, sorry, why you must trust me? I'm working in the industry for the last 20 years, worked across Asia Pac, and especially worked in enterprise architecture practice in the last 8 years, specifically on architecture space. And specifically I've worked in the domain as health, education, bank, environment. And at the same time, to be myself to par with the market, I've got the industry certification, as you can see from here, from TOGAF, IT, Archimate, and again, all the industry certifications, right from it can be AWS or Azure. So said that one, to prove myself again, I got a PhD. Again, my PhD, based on that one, I just come out with a book. It's Center for Architecture in the Era of Digital Technology. So said that, let me just go for the meat of the session, what is today. Again, it's a disclaimer. So as you can see here, any information we're providing, we try to our best to give as accurate as possible. At the same time, I hope you guys will not sue me if anything it is wrong. Okay, it's a disclaimer just for that purpose. Let us look at the agenda. So as you can see here, because of COVID, enormous amount of data is generated. So how to manage this data, how to create value out of it, and at the same time, how to innovate. That is the key objectives of today. And I'll be taking 3 areas specifically. One is the way we are working, that is especially remote working from home is becoming a norm of the day. Then I'll be taking the perspective of education and health. So I'll be covering on these 3 areas. At the same time, at the end, based on these 3 areas, how AI plays a predominant role, and again, how digital twin can able to play a predominant role, and what is RPA. So these are the few things I'll be covering. Okay, now what has changed? As you know, with COVID, first of all, we are confined. Because of confinement, what's happening? We are staying in the home, we are working from the home. That's good. Even the kids' education, right from year 1 or might be even a kindy to all the way to university, it's from the home. Health. Telehealth was not a big thing in the market before, though it was a reality. Unfortunately, it was not followed. But now telehealth has becoming a reality. So at the same time, I'm not talking about shopping. I just want to analyze food is an essential thing, but food as staying in the home, still farmers are doing their work. So for us, persons especially confined, we're looking mainly at the shopping. So shopping also has changed. To complement this, again, some services is not a have, but it is happening. Like even our social circumstances have changed. So the way we socialize, even we want to find our partner, that is dating exchange or entertainment, exercise, dining, and ultimately even the religion. Some of the famous temples having per day more than some 10,000 worshippers has become online. So that is the way COVID has done. But one key thing, all this is giving some kind of information for us that I'll be discussing in the coming slides. Okay, let us say because of confinement, what's happening? See, wherever we are going, your location tracked. Might not be in every country, but in some countries, you're mandated to carry your mobile phone. And once you carry your mobile phone, you're tracked. And again, if you're having an app, the Bluetooth is going to exchange the information. If you go to a shopping mall, in some countries, it's a mandate. You must show your actual identification. And based on regulatory requirements, some data is captured. So ultimately, what is it creating? So telcos are taking your information based on your movement. And again, if you're using Apple or Google phone, Google by default, they're tracking your information. And depending on the type of the country, some of the information will be passed to regulatory requirements. So again, why? It is just to prevent COVID spread. That's all. Okay, but again, from this, what's going to happen? Let us see. See, what is with all this, huge amount of data is generated. And again, some of the data is very sensitive because you're sharing your personal information. Then some of the data is voluntarily given by us and some involuntarily collected by various agencies. So from that perspective, let us look at three use cases. One is work and the other one education and health. Okay, let us look at what's happened in our employee data, how it has been collected, how our work environment has changed. Before COVID, what was happening? We are going for the office. The only data that was captured might be if you got an access card and if you, it might be captured, or if they got some office camera that the information is captured. In the current, the reason if you're going to your office that is captured, there must be a reason for you to go to the office. Post, whatever legally permitted will be captured. So that I'll be explaining in the coming slides. What are the legally, what can be captured, how we can get value out of it, I'll be discussing the later slides. Then, working from the home, what is captured? Before you go to the home, if you got a VPN connection, might be captured, was captured. Now, any kind of remote meetings, that is being captured by some companies are not recording. Post, again, I'll be discussing what all will be captured. Then let us take the next use case, the student data. Before you go to a classroom, you sit in a class, and especially in high schools, especially in some colleges, you have nothing to be captured. You don't have an attendance. So you go to a class, you get a session, you come back. So based on that, again, if a student has got some access card, if he goes to a library, that might be captured, or some school cameras. And now, especially with current COVID, the reason why they are going. So in the post, again, I'll be discussing later in my slides, what are the things can be captured. Again, study from the home. At this moment, access to LMS. That before COVID, if you have a learning management system, that was captured. Current, see, though education industry was looking at the way of delivering the lectures remotely, but unfortunately, they did not adapt this model. What we call it the MOOCs, Massive Open Online Course, because the main reason was it was a business decision. So, but unfortunately, when COVID came, the universities were not prepared. They're just doing remote webinars, and from there, they're conducting the classes. So, post-COVID, the entire thing will change. That again, I'll be discussing in the coming slides. When I come to the value, I'll be discussing about that. Now, let us take the health data, what has been captured. See, before you go to a hospital, your patient registration will be captured. Hospital, if they got some cameras, that information will be captured. Current, if you go, first of all, unless until it's a emergency, or you're not allowed to the hospital, or any other reasons, you must have a valid reason. Post, till the patient recovers, legally whatever the data is permitted will be captured. Okay. Then telehealth. Let us from telehealth what is captured. Telehealth, before, if a patient has got a problem, he may make a phone call to the hospital. That is the only information captured. Current remote treatment, even it is just like a webinar, because many companies are using Zoom or some other WebEx tool to talk to the patient. Post, again, the information be captured and becoming in the coming slides. So from this, what you are understanding. So what we have understood from this is huge amount of data is being generated, which was not expected before COVID. So to manage this data, the most important thing is we need to have a proper strategy to manage. See, in the industry, what they say is 80% of the data is never been utilized for a proper usage to get some business outcome out of it. At the same time, many of the information that's captured need to be properly managed. At the same time, it must give a business value, and at the same time, it must be having some kind of an innovation where ultimately the cost of the service must be reduced. Okay, so as you can see here, as per the NIST, many companies don't have a proper framework to manage especially the human-centric data using the technology as AI to understand what is the specific or information of the data. Let us see how to manage the data. What is the best way? See, before COVID, I mean, there was many companies, data architecture or data is taken as the last entity in an enterprise. So what, based on the research, based on the projects, what we have worked, what we have come out is the data must be in tandem. As you're doing a business requirement, data must be as part of it. That's the first thing. And the second thing, companies were, because of the CapEx model before, what we're having the SaaS model. CapEx model means you pay for whatever you want to use the services upfront. So because of it, what was happening is only the departments which had the funding, they were buying the products what is necessary to solve their particular business problem. So the data that was captured was specifically taken only from the perspective of that particular department. But moving forward, especially with an operational expenditure model or SaaS model, so what's happening is whatever we do, it must be taken from enterprise-wide. Why the reason? Because the reason is now any services we're going to provide, which is affordable, so it can be able to be utilized across the enterprise. So said that the data strategy is nothing but is a plan, need to be considered across the enterprise. So based on that one, we need to, how do we collect, manage, analyze, and how to visualize, and how do we ultimately, how it is count across the life cycle of the data, we'll discuss. So this logical model of the living enterprise repository, it has come out with working with the last 10 years in various companies. One of the main reason this model, what we are suggesting here, companies have got repositories, but the repositories are specific to, might be it's a finance, it's a HR, though they're related, it's not in real time. Only might be at the end of the month, they want to come out with some reporting or some kind of an analysis, or might be the year-end report. They take the data and come out with some kind of an option. But look at COVID, what we have realized. So one of the key things for any enterprise with success, we need to have the access to the data in real time as much as possible. So this enterprise-wide repository, what we are proposing is connecting across right from the strategy to all the way to the implementation of the code, wherever the data is there that need to be captured. So this is a process. So the planning must be across the enterprise-wide. Identify the data, what is relevant and what is required, and collect it, store it. Again, storage is a very important thing. I'll be discussing it a bit later when I come across the security, and need to be well managed and analyzed. At the same time, it must be more visualizable, because unless until you have a visualization, users are not able to understand. Why the reason? See, before our smartphones, users had a patience of looking at a data, might be looking at Excel sheet kind of a format of a table or whatever it is. With this mobile intuitive phones, intuitive user interface, they need to have proper, which is visualization, which they can able to really make some kind of a comprehension of it. And especially with COVID, what we have realized is any information which is not of any security risk can be shared, which can able to comply with our privacy acts can be shared. Only with that, we can able to get a proper information. So said that whatever the data that is legally shareable must be shared across. To manage all this, we need governance. Right from we plan from the enterprise wide till the data retirement or archive or to the end of the life cycle of the data, it must be governed. So how to do that one? So as I told you earlier, it is enterprise architecture approach. What does the enterprise architecture approach does? So let us take an enterprise. The enterprise, if you just take a hospital, yes, it works in isolation, but we go a little bit one stage upper. Then we got a Ministry of Health example, for a government. So many hospitals, they work independent, but though the standards are set from the Ministry of Health. So moving forward, the enterprise architecture, what it says is a standard that is set across the Ministry of Health must be cascaded across all the hospitals within that specific area or specific country or state. So only with that, we can be having a standard across followed in an enterprise. Then, so before it was not happening like that. If you got 10 hospitals, one hospital, depending on the budget and depending on the type of resources they had their own systems. And because of it, what happened is, if any Ministry of Health, if you go to a country, they'll be having 10 different systems, which is not connected. So in reality, especially moving forward, what we have learned is we need to have the data, like one patient record or one information which can be able to get some real-time value out of it. Then let us look at the architecture. So every enterprise exists to give some kind of a service. Again, to implement the service, historically what was happening is, depending on the type of the department, they were buying the products. The products, what was bought is something like a black box. The architecture was, we never knew what is the architecture under the product. So moving forward, so what was happening is we had systems which is completely black box, and the black box, to share the information, we are coming out with our own hard-coded adapters. And again, as a technology mode, we got web services, we got REST APIs, that's good. And moving forward, especially with, as I told you, the SaaS model, now we got information in the cloud, we got information that is generated through mobile phones, and again, with remote health, remote working, so much of information is generated. So ultimately, what is enterprise architecture? It's a holistic approach that proactively realizes what is a business vision, and to realize a business vision, what kind of technology exists, and how to abstract the technology with the actual business requirement. Such a way, at least the business must not be tied up with the product. It must be abstracted, so it can able to change the technology as the business, as the technology evolves. That is the objective of enterprise architecture. So in reality, we can be able to give the treatment for a patient, whether it's coming to a hospital or remotely. There's a technology, it is possible. That is the way it must move on. Again, enterprise architecture does not work in isolation. Enterprise architecture is a combination of people who take the decision. Again, some kind of a process need to be followed, and a technology. So it's all interrelated. It does not work in isolation. All must work in a tandem. So one of the key thing of enterprise architecture is, what we do is, we don't reinvent the wheel. What we do is, we try to refer what are the standards in the industry. So based on that, we try to get the architecture and follow that one. One of the main reasons why we need to follow this, the main intention is, once we follow this process, one of the key thing is, if we are compliant, at the same time, we can able to make effective usage of the technology. At the same time, we can be having, we can cut the cost. That's the most important thing. As you can see here, this is from the NIST, the Big Data Reference Architecture. What it is saying is, it is giving us a value chain. So how the information, right from its collection to all the way to its retirement or the end of the life, it is to be managed. Again, to manage that one, what it is taken as an IT value chain. Collection that can be IT value chain, what is the best way to do it? Again, how to prepare the data, because the data what we are getting need to be clean, need to be analyzed, need to be specifically for the specific department or for the specific business case, it need to be customized. Then based on that, we got some analysis, even for that we got IT value chain, and for visualization, and again, access. So said this, what we got is, we got a complete well-defined IT value chain that is defined by this. At the same time, why we are following this is, one important thing is, this keeps giving us a reference architecture that is vendor neutral and technology and infrastructure agnostic, especially with cloud. As you can see here, because of the advantage of cloud, we can able to see we are not having an upfront cost. It's all pay per usage. So depending on the best cloud service or depending on the best pricing model, we can able to change the cloud vendor. So said that if we got an infrastructure agnostic kind of a architecture, it's easy for us to reduce the cost and to get the advantage of the technology. Again, the cloud vendor, different vendors depending on their R&D, they got different features. So following this architecture, it will be easy to lift and shift depending on the type of the cloud vendor which needs the business purpose. Then let us look at the reference architecture I spoke. Now let us look at some of the key data breaches. As you can see here, in 2008, there was a breach in the health record, and that too Singapore is one of the countries which manages very well, but still they're able to hack. And again, Australia, is recently it was said that 54,000 of the driver's license was exposed in the public cloud. Though we got a digital transformation and with all this stringent requirements. And first half of 2020, 27 billion personal record were breached. So from this, what we understand is, it is like a chicken and egg race. There will be always breaches in that. So how to manage this breach, how to have the proper security. So especially in the security industry, for a hacker, a golden ticket is your driver license. From this, they can able to get huge amount of information. They can completely imitate you, impersonate you. So NIST has come with a privacy framework. What the privacy framework does is, it says is like the breach of a data does not only influence or affect a company, it mainly affects an individual, mainly because of the personal data. It can be health, it can be financial aspects, or even it can be social aspects. I hope you guys have come across how many marriages have been broken because of some of the illegal activities of the person exposed. So, of course, this is the nature of the world. At the same time, for an enterprise, what is the important thing? One is the reputation. And the most important thing is the penalty of what they're going to incur because of not following the regulatory requirements. So following a proper privacy act is the most important thing. As you can see from here, the most important thing we're talking about COVID. With COVID, what's happening is wherever we are going, it can be a shopping mall or it can be a public place. So a restaurant, we're giving our ID card. And especially in some of the countries where they're enforced to have an ID card which is valid before they can give an entry, you're compromising your vital information. First thing, unless because as you can see, just like last month, India just released a privacy act for the patients. So many countries still they don't have the proper privacy acts, how to be managed the personal data of a person. So as we know, the user data is the most important thing as we use any kind of a service. So depending on the type of the system or the product offered, it can be a third-party system, it can be in a SaaS model, it can be in-house. So the most important thing is the person does not know his data might be compromised or it can be hacked, we don't know. So the most important thing is, so if we implement a privacy framework which is properly, which has been industry proven, at least we can able to have some kind of standardization across the enterprise. So let us look at how to increase the success rate of the data management. So first of all, I just told you that to manage the data, the most important thing is we must be having an enterprise-wide view. That's important. And to have that enterprise-wide view, the key thing is we must be having an enterprise practice. That's really good. But how to make it more, how to get the success rate of it? So with COVID, what we have seen, first of all, suddenly people working in the office, they just were sent to the home to work wherever is possible. So the real global village is really prone because of COVID. The first thing. And second thing, what's happening is, it is already, outsourcing is a normal thing. Many countries I have seen like the design is done in some part of the country and the coding is done in some part of the country. And the business management, especially the business process management is done, the BPOs is done in some country. So if we have a proper language, so what happens is the success rate is increased. So this is the modeling what we have come across working in various projects. So what we are telling is it is possible with the current modeling techniques available in the market, right from the strategy to all the way to the technology layer. It is possible to model. So if you have a proper model, what is the advantage? Especially with the staff working remotely in different places, they can able to have the access to the information. And the key thing, especially with the data, unless until we get in real time, it has got no value, because some of the data, it becomes stale. It has got a shelf life. So within that, the data need to be captured and to be managed. So once we have this well-defined structure, well-defined interfaces, we can able to clearly identify what data is generated at which part and how to manage it effectively. And look at the current practices, what's happening. So why it is very key indicator. This is the current what's happening is the as I told you earlier, the business requirement and the data requirement work in isolation. So huge amount of data is generated. Again, the information is spread across with multiple documentation. And different team will be having their own templates. They got their own conventions to develop the data. And many architects, they use Visio as an enabler. Again, the Visio, one of the key thing is it depends on the creativity of the architect, how well you want to present it. And again, there's no standard naming conventions at all. And it's not possible to get a holistic view because you need to refer a number of documentations. Let us look at what's, especially if you're working remotely. See, if you're working remotely, one is the language barrier. And especially when you're working in the office, at least some of the documents where though you don't have an access, you can go to your colleague, you can able to look at the document. Working remotely, it's not possible to get that kind of an access. And there's no single view at all. So how to manage this? So for this, we need a modeling tool. So if you have a proper modeling tool, what are the assets possible if it is captured and put in a well-defined repository? Again, the repository can be defined. You've got so many frameworks. It can be from TOGAF perspective. It can be from business PPM perspective or UML. You've got so many ways to define the repository. So depending on type of the company, if you can able to have the assets in a repository, first of all, based on you can able to get a 360-degree view, means the complete view of the data what we are having. At the same time, based on historical data and forecasting, you're able to get the future state of the data too. Then again, with this one, the consistency across, that is very critical moving forward with COVID. I'll be discussing again like why COVID is going to change the way of the workforce, how it's going to change. I'll be discussing in my later slides. So considering that, it's very critical to have a proper modeling tool with a consistent modeling across the enterprise. And this will enable the collaboration with different teams. At the same time, with a proper tool, it's possible to simulate the business requirement. The business users can able to get what is the impact or what is the services they're expecting or the new business model, how does it look? So it's going to help us with impact analysis for decision making. Again, once you have a tool centralized, it's possible to have reuse the assets. And again, end-to-end, you can be able to have a traceability. That's very critical moving forward. And many of the projects have worked. Documentation is given the least priority. And especially companies going towards Agile, they say document is the last. But you have a proper EA tool, it's easy to generate the documentation. So what is Silverblood for this? You have Erwin Edge platform. It has got an enterprise architecture tool and it's got an end-to-end business process modeling. Again, the data can be mapped and at the same time, it can be modeled. And the very important thing, as I told you earlier, in my model, in the logical model, what we have come across, you must be having an intelligent enterprise. To have an intelligent enterprise, the data must be intelligent, which is consistent, the quality is assured. So with the data intelligence capability, what Erwin is having, it is possible to have the real-time information that's going to fuel the growth of the enterprise, of an organization. So let us look at how to create value. See, I just want to ask you a question. Oh, sorry, because it's remote. Okay. Just imagine yourself, if the iPhone is manufactured in Australia or US, what will be the cost? Easy, it can be about $10,000, depending on if you just make some analysis. What is the minimal wages provided to a person in Australia, US? The cost can go up. So said that, you must make a call. If a company is able to see if a person is able to work remotely, by default, it will be outsourced or offshore. Just to give an indicator, the cost of a good programmer in India is about $15,000. The cost of a good programmer, the average programmer in Australia, the average salary is about $90,000. In US, it is about 70 USD dollars. So if a person is working from the home, definitely the company will prefer to outsource. They can able to save money on that. And the second thing, a cost of an employee, if the office in a good location, is going to cost them an average of $20,000 per employee. If a company is having 100 employees, easy it's a 2 million per annum. So it's a good saving for a company to have the employee to work remotely. And with COVID, it's proven it is possible for employee to work remotely. See, before we had digital transformation, the digital transformation, what we're trying to do is we want to give the services for the end user, whatever services he can able to access wherever, whenever he wants. With COVID, the companies realized is not only to give the services for the end user customers, even our staff must be able to manage remotely. And it is being happening. And just for information, in the last 3 months, what they're saying is the cloud migration is gone up by 300%. Of course, the good news is, yes, they're going to cloud. The bad news is lift and shift is good because the systems are not done for horizontal scaling to use the elasticity of the cloud. So they'll be getting a hefty bill. Okay, so then let us look at the education model. So the education model, as you can see here, so my daughter is doing a medical. Almost since last 8 months, of course, she went for first 2 months. In the last 6 months, she's in the home, having a medical degree. And only in the lab necessary, she visits the hospital. Otherwise, she's studying from the home. So said that, what happens in the future? The remote learning becomes a norm. Labs, only on the need basis, students will go to the labs. Lessons there will be remote learning. And at the same time, even like your examination can be remote. Or it's proven. It's a lot of certifications when you take. It can be PMI, it can be TOGAF certifications. It's already there on remote, or you can take the exams remotely. It's proctored from your mobile, from your whatever the device you're using. So remote learning becomes a norm. So why it becomes a norm? So as you can see, the cost of a degree easily can come up to 30 to 40K depending on which the type of the course, the country you're studying. So with remote learning, what happens? Already you got this MOOCs concept, like example like Cloudera, Udemy, as the Udacity. They're already providing courses which has been recognized by universities as Cambridge or what is that? A lot of universities, Harvard, they're recognizing some of the courses which has been taken from remote learning. As you can see in the right side, this is the 50th convocation. Again, it is a virtual reality mode. So it's happening. This will be the future. Then let us look at the health model. The health model will go towards the hybrid. Hybrid is already telehealth is there. In fact, I did a project somewhere in 2030. It was a telehealth project in Mongolia. Mongolia has got a population of 3 million, and it is widely spread with something like 3,000 kilometers wide. So what telehealth was a norm there, because it's not possible to have doctors spread across Mongolia, a density of 1.5 population per square kilometer. So with telehealth, especially with 5G and with especially the vital signs that can be able to be managed, so it is becoming a reality. There was an example like some statistics. One of the hospitals in the US, they had less than 500 people taking telehealth service. With COVID, now they got more than 20,000 patients taking telehealth service. So telehealth will become a norm. See, especially when COVID, what the countries have realized is the ratio of the doctors to the patient is very minimal. So one of the key thing is as you can see in some of the developed countries, they got huge death rate. It's not because the death rate is there, because the reason is some hospitals, they don't have the equipment and the doctors to treat the patients. That's one of the key things. So as you can see from here, with telehealth, it's possible to capture the data in real time and able to get huge amount of information. So this is the value add what we're going to get. So based on this, we have identified what are the key things that can be captured from the end user who is working remotely or having his education remotely or a patient getting a treatment remotely. First of all, you can able to monitor and control what the example, if he's using the services, what he's using. And eye tracking can be captured. And the students, if it is there, the real time, we can able to view what the student is doing. We can prevent the browsing. Of course, we cannot able to prevent the browsing for an employee, but especially students like primary or middle school, especially the tutor or the whoever the person controlling, he must be having that kind of a capability. Then the type of the application, what they use can be monitored. At the same time, even the information, especially with COVID when it happened, many of the outsourcing companies in India, they just send the people back home to work remotely. But the person did not have the facility to, especially having the confidential data to work remotely. So they send some kind of lightweight systems, SaaS based, and they remotely connected to the office. So with that, the real-time information of the voice was very important. Internet security, as I told you earlier, the breach of data has gone up by 2 million. So that's very important for proper internet security. That will be the future, which is very critical. And especially for students, and augmented reality and virtual reality become the key thing. And for a patient for telehealth, the key health indicators, the vital signs can be captured. So this is the higher level requirements, what we have identified. So once this information identified, how to make use of that information, that is the key thing. So let us look at, especially with, we call it cognitive intelligence. So cognitive intelligence is right the way the person interacts with the other person, the messages he sends across can be captured, can be analyzed, as you can see from the screen. At the same time, with the cameras, we can able to capture the facial expression of the person. If is he concentrating, is he involved with the meeting? So similarly, it can be for a student, at the same time for a patient too. So with this, we are capturing huge amount of data that was not even thought before. As an indicator, by 2025, we'll be having 175 zettabytes. Just to give an indicator, 1 zettabyte is equal to 1 trillion gigabytes. If somebody is having a mobile phone, if you're having a good phone, might be having like 100 gig space, a max. So said that you can just think 1 trillion means how much of information is there, and 172 zettabytes by 2025. And by 2020, they given an indicator is 47 zettabytes, but I think it's going to go more than that. The reason why, I'll be telling you at the coming slides. So to manage this amount of huge data is not possible just with the normal systems what we are having. So definitely you must use AI. As I told you earlier, 80% of the data that is captured has been never utilized. So with machine learning, because machine learning 5 years back, it was an expensive capital expenditure for a company. But with cloud service, machine learning is affordable by any company. So what is machine learning? So machine learning is nothing but from the data, we can able to identify some kind of heuristics or using some kind of statistical model. We can teach the computers to take some decisions. So with deep learning, we got to further refine it. And though it's not possible to replace the human brain, but with neural networks, we can be having some kind of an artificial intelligence. So it can able to simulate like a widely connected brains with nodes. So it can able to have some kind of simulation like a human brain. Again, it's ever evolving. I don't think in our lifetime we'll be having a system, a neural network, something can able to replace a human brain. It's a long way to go. So with the building blocks, and again, as I told you earlier, many countries, they don't have proper data security, especially the way the user information, what kind of compliances need to be followed. So said that the data disclosure means the data at rest need to be encrypted. Data at motion must be encrypted. And many of the algorithms to use the machine learning is not transparent. Generally at this moment, it's all of like a black box. You give some information, you get the information, it's not been exposed. So said that depending on the algorithm, where it has been developed, which country is offering you. So you're having a threat of the data which has been given there and taken back. Because generally the algorithms, the current practices, what they do is whatever the data that's encrypted is getting decrypted, then it goes into algorithm to generate some kind of a outcome out of it. But luckily in the last few years, we got homomorphic encryption. What is homomorphic encryption is going to have the data that's encrypted. Even the algorithm can able to work on the encrypted data. And again, that encrypted data, what is the outcome? It goes back to the actual user who owns the data, and he can able to take a decision whether you want to share the data or not. So with this, especially with remote working or work from home, and again, as I told you, any job it has been remote working will be outsourced or offshore. So homomorphic encryption is nothing but a very good thing to have, and it's a reality in the future. And moving forward, especially sharing the information of the patient, we need to have some kind of data ethics. So what information can be shared, how the information can be shared, how it needs to be massaged, how it can be obfuscated where users cannot able to make sense of the data if it is being even exposed. So all this need to be taken into consideration. So for that, we need to set up a data ethics in a company and to set up a practice on this basis. So just look at here. This is a very interesting, I want to convey the message. So as I told you earlier, like working with COVID, enormous amount of data generated or will be being generated. See, the first when COVID came, many companies, especially in health or might be education is the key thing. So they just took the tactical model. What the tactical model is? Just to have a webinar and conduct session to the students. Unfortunately, that's the only way they can do at this moment. But moving forward, so what's going to happen is each and every student, as you can see here, if you got like 30 students in a classroom, so all that is 30 students will be captured. As you can see the left side, if a student goes, none of the information is captured. And whatever the information is captured is only one camera, two cameras getting captured. But in the second mode, when you're going the virtual classroom, every student activities can be captured. The eye movement, the facial expression, the browsing habit, everything is captured. So said that the 30 students in a year, they got like 4 semesters. Each semester is 40 hours. So 40 into 4, 160 into 8 hours, a session, in the 4th section, 160 hours is completely captured. So said that from this, we can able to identify new patterns that can able to change the behavior, how the education will be done in the future. At the same time, even for a employee, all this information can be captured. Similar to a patient also. So if you think UTS University in Australia, they got about 40,000 students. So henceforth, with the virtual classroom, all the 40,000 students, if they're taking a virtual learning, the information can be captured. You can just imagine how much of data that's going to generate. So look at, take a numbers, if it becomes an option from primary school to all the way to your university, you can imagine the data that we generated in the future. So remote perinatal care is remote telehealth is one of the key things, as I told you earlier. Again, companies are already jumping into this arena. As you can see here, this is from Philips. It is possible to have the prenatal care of the expecting mothers. We can able to track the vital signs. So with COVID, this will not only be applicable for prenatal. So wherever possible, whatever the information captured from a patient will be captured henceforth. So let us talk about the information what we captured. So I introduced a new concept called digital twin. What is digital twin is nothing but a digital model of the real life object or process system. So the data what we are capturing of an employee, a student or patient, we can able to create a digital twin. So once we're able to create a digital twin, we can able to simulate how the user behaves or what is the way the person works. We can completely able to simulate and able to have a replica. So all this years, it was not possible to create a digital twin unless until only for some specific projects it was being created. But with the amount of data that is generated henceforth, with the remote working, with the remote, especially the students, and with the patients. So this is a reality. Then from digital twin, what can we able to get out of that? So the next concept is robotic process automation. So robotic process automation is nothing but whatever a human being does, The same thing you want to simulate using a bots. So why we need to do this? The main intention is with COVID, what the companies realized is they need to have less dependency on human beings. So whatever the task repeatedly done by a human being must be replaced by a bot. And whatever the task can be managed by a bot must be managed by a bot. So said that what happens is with the way we are capturing the information, the activity a staff does in his activity is captured. So with this, digital twin is a reality. It can be done very shortly. At the same time, robotic process automation can be enhanced and further taken to the next level. So with these two combination, it is possible how to innovate. The innovation is, first of all, the repeat task can be replaced by bots. That's the important thing. So now you have a staff. Example, some companies, they follow the pattern of sun. As the sun goes, they're going to follow the same pattern. So on that basis, what's going to happen is we're going to look at an employee working might be in New South Wales or New Zealand at the same time in India. We can able to collectively see what is the best process, what is the best way the same process can be managed, can be done. So with this, what happens is companies can able to do mining of the process and they can able to effectively find out the optimum usage of the processes. And the learning can be targeted to the student specifically. And the patient treatment can be reduced drastically with digital twin and RPA. I'll not go without what we do as a company. We just, this one I'll just leave it to you guys. We want to assess the transformation because every company want to go for transformation as an enabler. Yes, but we're going to first make the assessment. Is it really relevant for your company? Then we determine the expectation. Do a maturity assessment. When you go to a doctor gives a treatment, based on your before he starts the treatment, he examines you. So similarly, we make a maturity assessment of the patient. And based on that, we select the type of the model or capability what they need. Determine the skills. Then finally, again, the skills, because when you want to learn, do a new way of doing the thing, the employee skills also must be enhanced. So we look into that aspect. Then afterwards, we look at the product, what suits the company. So the key takeaways today, see, COVID-19 has given us unexpected and enormous amount of data that needs to be managed to get value out of it. Again, the data that is managed historically, it was not done from an enterprise perspective. It must be done from an enterprise-wide perspective. Again, the data that is done from enterprise-wide perspective need to give some kind of a business value. To have the business value, it's very important to have EA practice. Again, you must be having a tool. Without an EA tool, it's not possible to get the benefit of the data what's been generated. Again, the data need to be properly structured, analyzed, and to analyze, we need some kind of artificial intelligence. Only with that, we can get real value of the data that will be generated enormously in the coming years. So with this, I end my session. I just open up for question and answers. Please be free to ask many questions. I hope I gave the value of your time of 15 minutes. Thanks for your time. Yeah.
Thank you, Dr. Sunia. The first question that came through is, how does visualization tools knows the requirements from source system unless at the time of creating data has been set up?
It's a very good question. Say definitely visualization, the way it's happening, it's not able to manage unless until the data is well properly structured. That's the main reason we need to have a proper EA practice and modeling practice. So once we have got a properly well-defined data model and having a proper tool in hand, so depending on that, we can able to, because the business requirement keeps on changing, especially with the visualization. So if you have a well-defined data abstracted, not tied up to a model, to a visualization tool, it's possible to manage.
Okay, the next question that came through is, during COVID-19, different private hospital, individual practitioner is generating lots of data, but those is out of central database of government. So it is tough to generate decision. Any comments?
No, it's a wonderful question. whoever the user it is, I really appreciate this. See, the important thing is, that's why as I told you earlier in my session, many countries don't have proper policies how to manage the data, and there's no centralized process. So that's the reason I told you we must be having a E approach. And the data, what is that generated? So government must come out with some policies and to enforce to first of all, to send the data to a central repository. At the same time, to put some kind of a compliance, the data must not be shared. And again, many places have worked, still the data at rest is not encrypted. So they must come out with some policies. And again, that's for the reason I told of the ethical issues. So the companies need to come out with the ethical issue to see how to manage the patient data.
Okay. Another question is telehealth. It has been challenging for remote patient who has less access and understanding of technology. So, any comments on that?
See, it's really a good question, because what we are seeing is, like, I was doing some work with some particular vendor. So what we realized, the world has got 4.5 billion smartphones. So again, like what we are seeing is, especially with, there will be someone in the home who are literate with the mobile phone, a smartphone. So with the smartphone, especially having a visual camera, it is possible to have. So unless until if the person is really literate, not able to use the phone, so definitely whichever the country, wherever they are, they need to get some help to facilitate that option for telehealth.
Okay. In view of the time that we have, one last question, which is, thanks for such an interesting and useful session. Could you please suggest how an RTO should manage recording meetings due to COVID-19 is generating lots of data in the clouds and keep them for full term and then delete it?
It's a very good question. What I suggest is, definitely please don't delete the data, because data is an asset. So whatever the data, please capture it. And especially because many companies, they just jumped into Zoom as an alternative because it is cheap, and many places it was affordable. So what we want to suggest is, please keep the data. And again, at this moment, there's no encryption. So have some kind of an encryption, because what's happening is, whatever the remote meeting you're having, anybody will be having the access. And especially with remote meetings, sometimes we'll be talking about the employee performance and all. And if it is in a shared drive, it is not a good practice. So what we suggest, please encrypt the data and create some access control. And please keep the data. The data is asset for you.
Okay. Dr. Sunia, 2 more questions came through. Do you want to take them?
All right. Please go ahead.
Yeah. Is there a high rise in organization reviewing their EA in this pandemic?
Oh, that's a wonderful question. One of the key objectives of this seminar we are doing is because of EA is very critical for success. And one important thing, what I can see is, looking at the market trend, there are more companies jumping into EA practice. And again, just to say, like, I'm looking at this TOGAF certification. It was 10,000 about 7 years back. It has become 100,000. And just in the last 1 month, it has gone by 2,000 numbers. Again, a lot of tool vendors are into the market. So it shows the industry is maturing. Even the government agencies, a lot of jobs that's getting created. Enterprise architecture has become like one of the leading things. It is rising up, yes. And it become a de facto standard. Because without enterprise architecture, you're not able to get a visualization that can be spread across an enterprise. Only with EA, it is possible, and it is really taking off the market.
Okay, last question is, how secured is the data in clouds, and do you see work from home a reality in future?
So work from home, I wrote a paper in 2012. Because of cloud, the whole remote working will be, the outsourcing will be changed. That time I never envisioned about this COVID. So especially the data that in a cloud is much secure than the data in your on-prem. The reason is, all the cloud vendors, they need to have all the compliances. So again, it's a shared entity responsibility. So said that if the properly well structured, and if you got well access control role based, 101%, data is very secured in the cloud. At the same time, remote working is a reality. As I told you earlier, the cost of a phone to manufacture in Australia will be $10,000, and companies have seen the benefit of an employee working from home. So with that, every company already they'll be planning how to outsource or offshore. It is a reality, and we must be prepared for that. Thanks for that wonderful question.
Okay, with that, we conclude today's webinar. Just to remind all, this is a recorded session and everyone will be sent a link to access this webinar and you can review it at your own time. So with that, thank you, Dr. Sunia. You may now all disconnect.
Thanks, Lord B, and thanks to all the audience and Erwin to give me this opportunity. I really appreciate for all the audience who came for this and spending your valuable time. I hope this session triggered something in your mind and be useful for yourself and for society too. Thank you very much. Have a nice, wonderful afternoon.